cancer is a nasty disease, like I guess, unfortunately, many of you do know. And it needs really heavy treatment. And these heavy treatments, these are causing to multiple patients, I would say most of the patients, severe side effects. When we founded Noona 2.5 years ago with my colleagues, we made a realization. We saw that only few hospitals or cancer clinics are systematically monitoring how the patients are doing in between the visits. And we thought that, this doesn't make sense. Why? Because most of the side effects and symptoms are predictable. So you can actually see the first signs, you can see the early signs hours or days before, based on the patient-reported outcomes data. Sorry, is there somebody could? Okay, no, it's working, sorry. So Noona is an easy-to-use mobile service. It's designed for cancer clinics to monitor their patients' well-being. We didn't want to do this alone, so we partnered with our clients, to mention two, Helsinki University Clinic and Stanford Medicine. And I think that was by far the best decision we ever made, to have a co-development with this kind of hospitals on this field. We have had a good start in Finland, where we are based. Every university clinic is using our system. And yes, they are paying for it. And now we are preparing for a launch in some Europe countries and in US. We are also partnering with pharma. We just made our first deal with Merck in Europe. It's about co-promotion. And this is my usual joke. There is something wrong with this picture. They are all Finns, and they are smiling. Personally, I'm super proud of one thing. It's that we have a chance to work with people like Ethan and George. They are the true key opinion leaders on this field. And what they say is that patient-reported outcomes is one fundamental missing link in a cancer. So let me show you Noona. We have two goals with Noona. One is that when the patients are using Noona, they will have less symptoms, less severe symptoms, and B is about saving resources. So they will have less unplanned visits to the hospitals and emergency rooms. So let me show a fictive patient use case, how Noona is functioning. We have a breast cancer patient here, Maria. She has been using Noona's diary like the past 3 days. She is not doing good. So Noona is asking, like, Maria, how are you doing? And Maria feels not so good. So what she does is that she signs into Noona. Noona is asking, what is it about? And it's about pain. So Noona is asking, where is the pain located? How long has it lasted? In what kind of situations does it occur? So we are collecting here a lot of structured data. But one thing you might find the most interesting in here is that we have been teaching Noona to automatically identify if the symptoms are severe. So we have been building hundreds of clinical rules into Noona that it could automatically identify and tell the hospital if there is something wrong, and also telling to the patient if there is something wrong. So now Noona is asking Maria that, would you like to send this information to the clinic? Maria thinks, yes, this is correct. And what happens is that Noona is analyzing the results and telling Maria, the patient, that, okay, there seems to be something wrong. You shouldn't be too worried. We will get back to you soon. And what's happening at the same time in Stanford is that the nurse comes to work in the early morning. She realizes that we have two acute cases. One is Maria. So I would like to right away see how is she doing. So we are providing here quite a holistic view to the nurse and also to physicians about Maria's situation. So on the left side, you see the symptom information. On the right side, you see the diagnosis information. And now the nurse has option A, to call Maria in or send the invitation via Noona. B, nurse can ask Maria to follow up the symptoms like the next 3 days. Or C, nurse can send some self-care instructions to Maria. And I really love Noona, especially the user experience and the design, but I don't think we are in the business of selling services or software or anything like that to our clients. What we are actually selling is a better treatment results. We are selling efficiency, and we are also selling happy patients. Thank you.
Thank you very much. So in your application, you talked about using AI, artificial intelligence, in your platform. Could you just go into that a little bit more and say what your plans are or your thoughts are around that and how that might be applied?
Yeah, that's a good question. So we started with the clinical, rules. It means that those are rules made by humans. So we have a rule machine, how we started it, and we have around 500 rules at the moment. So, and now we are in a stage that we start to use the data that we have collected. So we are just starting to work with, for example, with IBM Watson to understand that how could we predict bad things based on the data, not just using those algorithms and made by humans.
I see. And you mentioned working with Merck. Can you give us any details generally about how you might be able to work with other pharma companies? Because I understand the application with hospitals and with patients, but less so with pharma.
Yeah, that's a good question too. After discussing with the FDA people, we have a feeling that in the future, every clinical trial needs to be a PRO element in the future. That's a really good way to work with pharma companies, the clinical trials, but also the real-world evidence studies, because I'm sure that there are a lot of insights regarding cancer and cancer patients' daily lives that we don't have a clue at the moment. Actually, I think no one knows really well how the patients are living their lives when they are under the treatment. So this is something new.
Okay, thank you very much.
Thank you.